Pharmacists, on behalf of all doctors, fine, maybe not on behalf of all doctors, but on behalf of me, if we call in a prescription for a year of refills, why are we always getting calls that our patients need more refills? I don't understand. Like, a patient comes to the office and we say, okay, great to see you, everything's going well, blah, 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 yada, yada. Here's your prescription, I'm going to enter it for the full year. You don't have to come back till next year. And it's automatic, so you shouldn't need to call for the refills. And then, lo and behold, the patient calls that the pharmacy says that the doctor needs to authorize the refill. But we already did that. So what's the story? What's going on? Why does this happen? It's not just sometimes, it's a lot of the time. And I know it happens to many, many doctors, not just OBGYNs, not just my colleagues, but like doctors in all specialties. I've heard complaining about this issue. And it's so disruptive throughout the day. You get phone calls piling up, patients need their refills when we've sent in the refill for the entire year already. And patients start getting mad at us that we're doing something wrong, but in reality, we're doing exactly what we're supposed to be doing. Please tell me, how do we correct this?
My name is Maurice. I'm a pharmacist. It's definitely frustrating, but this is why it happens. Number one, electronic requests come over to cancel the prescription. Sometimes it's accidentally sent, and when it does happen, there's nothing we can do about it. That prescription's gone, and we have to get a new one. Number two, there's patients using the wrong prescription number. Sometimes they'll submit old ones through the automated system, and when you do that and there's no refills, they get told that by the automated system, and that's when they call you guys. Number three, there are patients that don't understand how refills work. I have to deal with this sometimes where a patient will call a doctor's office every single time they need a refill. And then instead of coming straight to the pharmacy, I'll talk to the office and they'll ask me to please inform them that they can just talk to us if they need a refill. It happens. Fourth reason I see is that patients just lose prescriptions, so they got to refill early, and because of that, they run out quicker than you expect. And then the last reason is transfers. There's patients that transfer medications all the time to all sorts of different pharmacies, and when you do that a bunch, you risk losing a refill because it's manually being input, and depending on the pharmacy you send it to, it's very easy to miss this. So most of the time, it's not because anybody's doing anything wrong, it's just sometimes we can't control things on our end and you can't control things on your end.